Sterile preparations should be prepared in Class 100 environments, which means they contain no more than 100 particles per cubic foot that are 0.5 micron or larger in size. Laminar airflow workbenches are frequently used to achieve a Class 100 environment. A laminar airflow workbench is a primary engineering control or device that provides the following aspects for aseptic compounding: clean air to the immediate aseptic compounding area, prevents room air from entering, a constant flow of air out of the work area, and an outward flow of air that suspends and removes contaminants introduced into the work area by personnel. The most important part of a laminar airflow workbench is a high-efficiency bacteria-retentive filter. First, room air is drawn into the unit and passed through a pre-filter to remove gross contaminants, such as lint and dust. Next, the air is blown through the plenum of the hood and the HEPA filter, and finally over the immediate aseptic compounding area. This twice-filtered laminar layer of aseptic air continuously sweeps the work area inside the hood to prevent the entry of contaminated room air. Let's look at the two most common types of laminar airflow workbenches: horizontal airflow and vertical airflow. Horizontal airflow workbenches sweep filtered air from the back of the hood to the front. An electrical blower draws contaminated room air through a pre-filter, similar to a furnace filter, which removes only gross contaminants. The pre-filtered air is then accelerated to ensure a consistent distribution of airflow through the final filtering apparatus. This final HEPA filter constitutes the entire back portion of the hood's work area and removes 99.97% of particles and airborne microorganisms that are 0.5 micron or larger. As you probably suspect, vertical airflow workbenches have a vertical flow of filtered air. Unlike the horizontal airflow workbench, in vertical airflow workbenches, HEPA filtered air merges from the top and passes downward through the work area. The critical principle of using airflow workbenches is that nothing should interrupt the flow of air between the HEPA filter and the component being used for the preparation of compounded sterile preparations. All materials placed within the compounding work area disturb the pattern flow of air blowing from the HEPA filter. To maintain sterility, nothing should pass behind a sterile object in a horizontal airflow workbench or above a sterile object in a vertical airflow workbench. Let's review the general principles for operating laminar airflow workbenches properly. A laminar airflow workbench should be positioned away from doors, air vents, or anything that could introduce contaminants into the hood. Laminar airflow workbenches should remain on 24 hours a day. If turned off for any reason, a laminar airflow workbench should be switched on and allowed to run for at least 30 minutes and thoroughly disinfected. Before use, all interior working surfaces of the laminar airflow workbench should be disinfected with appropriate disinfecting agent and a clean, lint-free cloth. Cleaning should proceed at a top to bottom, back to front motion, starting at the HEPA filter to move contaminants out of the hood. The hood should be cleaned between each compounding batch and when the work surfaces become dirty. The HEPA filter grill or protective grill should be cleaned carefully in a manner that avoids getting the HEPA filter wet. Nothing should be permitted to come in contact with the HEPA filter. Only objects essential to aseptic compounding should be placed in the laminar airflow workbench. Do not put paper, pens, labels, or trays into this area. Jewelry should not be worn when compounding since it can affect the integrity of personnel gowns and gloves and the effectiveness of hand hygiene. Actions such as talking and coughing should be minimized and, when necessary, directed away from the compounding work area. Unnecessary or rapid movement within or around the laminar airflow workbench should be avoided to minimize the turbulence of airflow. Smoking, eating, gum chewing, and drinking are strictly prohibited in the aseptic environment. Arrange objects to achieve the full benefit of the laminar flow of air. Critical items should be placed as close to the air source as possible. All aseptic manipulations should be performed at least 6 inches from the sides and front edge of the hood to prevent backwash contamination. And primary engineering controls should be tested by qualified personnel every 6 months, whenever the device is moved or if filter damage is suspected. Although laminar airflow workbenches, biological safety cabinets, and compounding aseptic isolators provide an aseptic environment that is safe for the manipulation of sterile preparations, it is essential that strict aseptic technique be used in conjunction with proper hood operation. Remember, the use of a primary engineering control alone, without the observance of aseptic technique, cannot ensure the sterility of compounded sterile preparations. Biological safety cabinets are designed to provide 3 basic types of protection. personnel protection from harmful agents inside the cabinet, preparation protection to avoid contamination of the work, experiment, or process, and environmental protection from contaminants contained within the cabinet. Any work with infectious agents must be done in a biological safety cabinet, not a laminar flow hood. Let's look at the three types of biological safety cabinets used during compounding. Class 1 cabinets provide good protection for the operator, but no preparation protection. Airflow is directed through the front opening, across the work area, and out through the HEPA filter on top. These cabinets do not protect your materials from contaminants, and thus would not be used to prepare sterile preparations. Class 2 cabinets provide personnel, environment, and preparation protection. Air is drawn around the operator into the front grille of the cabinet, providing personnel protection. And the downward laminar flow of the HEPA-filtered air minimizes the chance of cross-contamination along the work surface of the cabinet. Sometimes called Class 3 glove boxes, Class 3 cabinets provide maximum protection to the environment and the worker, and were designed for work with infectious agents that require Biosafety Level 4 containment. The cabinet is gas-tight and includes rubber gloves attached to the ports in the cabinet for manipulation of materials inside. Air is filtered through one HEPA filter as it enters the cabinet, and then through 2 or more HEPA filters before it is exhausted to the outdoors. An isolator is most simply a controlled environment with fixed walls on all sides. Transfer of materials in and out of the sealed work area is done with gloves, sleeves, and airlocks to prevent the internal environment from exposure to the surrounding environment's air. The NIOSH alert further defines isolators as containment or aseptic containment, depending on the need to compound sterile or non-sterile preparations. The aseptic containment isolator provides both an aseptic environment for sterile compounding and a contained environment to protect personnel and the work area. All ventilated cabinets, including isolators, must be equipped with an airflow monitoring device. Isolators can be pressurized in 2 ways, either positive or negative to the surrounding environment. Positive pressure should be used for compounding sterile preparations. For the preparation of hazardous drugs, ventilated isolators that recirculate the air inside the cabinet or exhaust air back into the room should not be used unless you are sure the hazardous drugs will not volatilize. As with the Class 2 biological safety cabinet, the isolator does not prevent the creation of contamination during the compounding process. The effectiveness of the isolator is dependent on design and the technique of the operator. The use of an isolator requires a stringent program of work practices, including training, demonstrated competence, contamination reduction, ancillary devices such as closed system transfer devices, and decontamination. Let's discuss work practices within an isolator. The aseptic environment in the isolator is achieved by HEPA-filtered air as a laminar flow, which can be unidirectional or turbulent flow, and sanitization of the isolator surfaces with an appropriate antimicrobial agent. Cleaning and/or decontaminating an isolator requires specific personal protective equipment. Before accessing the main chamber through the fixed glove assembly, don a pair of appropriate disposable gloves and a polyethylene-coated gown. Cleaning or decontaminating the interchange chamber of a negative pressure isolator should be done through the chamber door, wearing 2 pairs of gloves and a gown. And the antechamber of a positive pressure isolator should be decontaminated from the main chamber. Wear disposable gloves, a gown, and use the fixed glove assembly. Closed system drug transfer devices are currently available for many injectable antibiotics. The Advantage and Duplex are devices that allow the antibiotics to be transferred to the carrier solution in a closed system, avoiding contamination of the environment with active drug. Similar systems for hazardous drugs are being developed. This is more problematic as doses of hazardous drugs are generally not available in single vials. One such closed system drug transfer system has been studied. In several studies, Facile has been shown to reduce surface contamination during both compounding and administration as compared to techniques used before Facile was instituted. It should be noted, however, that Facile components cannot be used to compound all hazardous drugs. Newer systems should be studied for effectiveness in reducing surface contamination before they are implemented. As with any ancillary device used for the safe handling of hazardous drugs, training and the use of proper technique are required. The use of the Facile system is no different. Vaporized hazardous drugs pose more complex problems than aerosols because gases or vapors are not trapped by HEPA filters. Ventilation systems must be tailored to exhaust gases or vapor waste safely and properly. Whether your facility uses a laminar airflow workbench, a biological safety cabinet, or compounding aseptic isolator technology as a primary engineering control, the goal is the same: to increase patient and personnel safety. Each device has benefits and drawbacks, but it is up to the facility to make the best decision for the future of their business, personnel, and patients. Regardless of which system your facility uses, proper aseptic technique while working in your workspace will ensure your safety and the safety of patients.